Issues in Multicultural Counseling, Chapter 17, by R. Young. Issue 1. How inclusive should the multicultural counseling be? Some counselors think that the definition should be restricted to interactions between counselors and clients of varying ethnic backgrounds, mainly because of racism, injustices, and discrimination might be given short shrift if a more inclusive definition is adopted. Instead of broadening the definition, those who are opposed to an inclusive definition would prefer to use the phrase counseling multicultural population when dealing with differences related to men and women, gay men and lesbians, elderly people, and people with disabilities. Issue 2. How can counselors perceive clients' diversity? Counselors' perceptions of clients' cultural backgrounds undoubtedly affect interventions strategies. Issue 2. How can counselors perceive clients' diversity? Counselor perceptions of clients' cultural backgrounds undoubtedly affect intervention strategies. The stresses and strains of multicultural interaction may result in conflict that actually may increase or intensify clients' problems. Other counseling outcomes may result in improved relationships among people of varying cultural backgrounds. Considering our nation's growing diversity, counselors will continue to focus attention on several models of cultural differences, conflicting opinions regarding counseling approaches, and the effect of verbal and nonverbal communication between counselor and clients. The genetic deficient model. The genetic deficient model holds that culturally different people are genetically inferior. Rather than considering a person's record of achievement or motivation for self-improvement, many people use the genetically deficient model as the basis for making such decisions. The cultural deficit model. In the cultural deficit model, social scientists describe culturally different people as deprived or disadvantaged because they demonstrated behavior at variance with middle-class values, language systems, and customs. The culturally different model. The culturally different model holds that people with culturally diverse backgrounds have unique strengths, values, customs, and traditions that can serve as a basis for enriching the overall counseling process. Issue 3. What ethical and legal standards should guide counselors? Counselors have an obligation to abide by the ethical standards subscribed by the American Association for Counseling and Development and the American Psychological Association, and to respect other ethical standards. Sue suggests that ethical multicultural practice involves 3 primary goals. 1. Self-awareness, becoming more aware of one's own values, biases, and assumptions regarding human behavior. 2. Knowledge of cultural values, biases, and assumptions of diverse groups in our society. And 3. Commitment to developing culturally appropriate intervention strategies at both the individual and system levels. Counselors need to protect themselves by being cautious and judicious. The author suggests the following guidelines. Inform families of the limits of your abilities as defined by education, training, and supervised practice. Maintain familiarity with state statutes regarding privileges. Clarify policies concerning confidentiality with both the child and the parents at the first therapy session. If you choose to work with the minor without the parents, informed consent. Ask the minor to provide informed consent in writing. Keep accurate and objective records of all interactions and counseling sessions. Maintain adequate professional liability coverage. When in need of help or advice, confer to colleagues and have professional legal help available. Issue 4. How can counselors most effectively assess clients of differing cultural backgrounds? Assessment in counseling and psychotherapy includes interviewing, observing, testing, analyzing data from cultural perspectives. Counselors should determine the extent to which diversity affects assessment, as well as provide an adequate response to several questions. Numerous issues have arisen regarding cross-cultural testing and assessment. Concerns include assessment validity, the use of inappropriate norms, ethnocentrism, and ethno-relativism, cultural stereotypes and prejudice, acculturation, and language barriers. Five questions should come to mind as counselors plan assessment in multicultural settings. 1. What needs to be assessed, and are those needs culturally based? 2. What types of assessment instruments reflect cultural perspectives and most effectively assess those needs? 3. What evidence do assessment instruments provide that indicates they are culturally responsive? 4. What precautions should counselors heed when interpreting assessment results? 5. What ethical and legal responsibilities are associated with multicultural assessment? Issue 5. What research concerns will be relevant in the future? Counselors should stay abreast of research development in the field, and furthermore, they should conduct research of their own. Majority of counseling practitioners do not actively participate in research endeavors, nor do they always keep up with the latest development reported in literature. The ultimate determination of counseling effectiveness depends largely on a credible research base. Selected research directions that would lead to greater multicultural awareness include the following. Evaluate the impact of multicultural counseling training. Determine which assessment instrument most effectively assess the needs of clients of differing cultural backgrounds. Determine clients' preference for counselor race or ethnicity. Study identity development within the context of majority and minority status. Determine the effects of race and ethnicity on diagnosis, treatment, and counseling outcomes. A point of departure. Counselors who wish to gain a better understanding of how culture, counseling, and psychotherapy and the lifespan approach are interrelated should consider the following recommendation. Actively seek to recognize basic issues pertaining to multicultural situations. Allow for multicultural encounters with clients of all cultures and at all stages of the lifespan. Keep abreast of research studies published in journals devoted to counseling and development in multicultural settings. Design and implement research studies with clients of differing cultural backgrounds. Understand one's own cultural background and commit to appreciating cultural differences rather than making value judgments with respect to diversity.